Hey guys, welcome back to another episode of the Altmed podcast. Got Mitch Kurtz in the house as always.
Literally.
And none other than the zooted TikTok legend himself, Cam from Heyday Medical. Cam, welcome.
Thank you. That was a beautiful welcoming. I've never been introduced as a zooted TikTok legend, but
well, when you are one, you don't need to be introduced as one. It's kind of self describing. But
although I am told that you have business cards with that title on it.
Well, I ordered 10,000, so I have to get rid of a few.
Should be enough for your followers. As per every episode we do, we'd love to get to know the guest we have on our show. For all of those out there that aren't familiar, could you give us a little bit of an introduction, where your kind of journey led you to medical cannabis, where you were before this, all of your story to date?
All right. So born and raised in Montana, in the United States, in a little town called Red Lodge, at the foot of the Beartooth Mountains. Moved over to Australia at the age of maybe 10, Aussie mom and an American dad. And we kind of went back and forth between countries from then on. So it's been a multi-hemisphere journey thus far. And then in the States, super adventurous family. Dad owned a whitewater rafting company. And so we spent most of our time out there. And that's where you start to get exposed to things like this at a whitewater rafting company. All the old guides are hobbling around, and I go, "Why does Dan smell like that, Dad?" Oh, it's just medicine.
Yeah, totally.
I fell out of the boat. I need CBD oil.
Yeah. And growing up, being exposed to things, being raised in a safe and judgment-free environment that helped to foster curiosity whilst not necessarily indulging things. So it's all about making it safe. And I remember Dad was on opioids for his multiple surgeries he's had. So he's had a life of adventure. So 3 hip replacements, a couple of back surgeries, knee surgeries. Kind of like a walking tin man. And when he came across medicinal cannabis, like delivered in a more strategic and informed way than traditionally, he was able to stop opioids. And so this was about 15 or 16 years old, and having some curiosity myself and access to the internet. Dr. Ethan Russo has been publishing studies for a long time. And so you hop on, you go, oh, well, let me find out what's going on here. And then the more you learn, the more you realize there is to know. And then you see that, oh, we don't really know anything about what's going on here. Getting on there, expecting an answer, and then being given explanations that just lead to more questions. And that suits this. I was lucky enough to have a healthy hyperfixation in this regard. And so coming into Australia, wanting to do a nursing degree because I thought I could just travel with it. So at the time I was doing photography as my work. And I thought, well, I can combine nursing and I'll be a travel adventure photographer nurse. Just make it up as I go along.
Yeah, I love it.
That's a highly Instagrammable title these days.
Brother, the algorithm shaped me.
Yeah, totally. Yeah.
But then, doing nursing and getting on placement, seeing what could be done, seeing the way that things are done. Like from early days, it was tailor the care to the individual. It's all got to be patient-tailored care. And I go, all right, I get this. Yeah, that makes sense. Everybody's different. Let's apply our care to the individual, wrap it around their needs and goals. And then you get in the hospital and it's like, hey, everybody's being given the same thing right now. Where's the personally tailored aspect of it? It's like, well, you say their name, don't you? I go, yeah. What more could you want? It's like, well, maybe we could start to really think about what's going on here instead of treating this as a moment to treat and diagnose something specific. Take a look at the bigger picture and give these people the tools they need to enact that self-care themselves, because ultimately no teacher will make you smart, no doctor will make you healthy, no trainer will make you thin. You have to save yourself. And so let's give these people the tools to do so. And cannabis is an incredible tool for that. And so during these nursing studies, I would do what I needed to do to get by my tests and exams there. And then I just spend the rest of the time learning about cannabis. And then a couple of years ago, I thought, well, I can't open a cannabis company because I have A, no money, and B, no experience. It's literally a pipe dream. but we can find a back door into this place. And so hopping on LinkedIn, connecting with everybody that I could. And then I reached out to Dr. Russo and said, hey, would you like to be on my podcast? Not really expecting a response. And immediately he said yes. I was like, oh, okay, I have to figure out how to make a podcast now. And figured out how to make a podcast, as you do, and then dice up the clips, put it on LinkedIn. And, you drop into that community, that sphere of people that are all working towards the same thing. It's like LinkedIn is this crazy home where they'll not only allowed us to talk about these things, but actively encouraged it. And that's where a lot of this started. It's a collaborative space.
That is, that's certainly been my experience as well. I mean, everyone's just very passionate and kind of just wants to share knowledge. Everyone's seemingly, even when you feel like you know quite a bit, you're always kind of thirsty for more information. And I have to say, I love that part of the community. So how was your chat with Ethan Russo, the legend himself?
Terrifying. I was so nervous, borderline having a panic attack. And I mentioned that to him within the first couple of minutes. And he's a very chilled out guy. He loves what he loves. He's got all his guitars in the back room. And I said, hey, I'm really nervous. He's like, don't be nervous. Let's go. And the way that he answers things as well, because I'm so wrapped up, and this is my first podcast ever, I'm so engaged in what he's saying, trying to consolidate it enough to where I can formulate some kind of coherent response that sometimes I wouldn't catch when he stopped speaking. I go, oh, that's the answer. Okay, we're moving on now. But he's a wealth of knowledge, and you tap into these resources, right? Like this person has been doing the work for 30 years through all of the trials and roadblocks of regulatory systems. And now we get to leverage his work. We get to leverage all of those years that he spent really in the trenches, and we can bring it to our patients. We can bring it into our care. And so from there, I interviewed as many people as I could. And then I got in touch with Jim from Heyday Medical. He reached out to me on LinkedIn, gave me a call, and we vibed out.
Yeah, it's very easy to do that with Jim.
It's so easy to do that with Jim.
Yeah, he's a legend.
Yeah.
We had a great chat with him on this very podcast, and just had a fantastic little to and fro. I imagine it's making me think, though, I want to get Dr. Ethan Russo, and that'll be amazing. I mean, I imagine he's pretty chill because he's got plenty of minor cannabinoids flowing around in his system, possibly. Who knows? A bit of terps.
That man, his endocannabinoid tone would be harmonized.
Yeah, I can imagine. It's in sync with the frequency of Earth.
Schumann resonance, yeah.
Yeah, what is it? Is it four hertz off?
Yeah.
Yeah, gotcha. That's really interesting. So, and that brings you to present day, where you're currently doing. Give us a bit of a rundown of the day in the life right now, because, like we jokingly said, zooted TikTok legend, but you've kind of almost got a double. I don't want to say double life, but you've got two versions of Cam that we see public facing, and I'd love to extrapolate on that for the audience.
Yeah, I mean, I suppose that it could be two versions, but it's really the same version. It's just that one is more niche. The cannabis stuff, getting into cannabis science, the people that want to hear this education, it's different from this other philosophical stuff. It really does converge, though, because right now we're at this time where all of these ancient philosophies and practices are being backed up by neuroscience. We're seeing that these yogic practices tie into central nervous system regulation. They tie into endocannabinoid system upregulation. They tie into every aspect of our being, and even the way that these ancient philosophers would look at the world and their the removal of desire and constant striving for acceptance. Those things are backed up by neuroscience, and it helps us to see that there's no point in being given the metrics if you don't know how to change it. And philosophy is one of those things that we can morph into science and apply it in a really tangible way. And even though the accounts, the social media stuff is different, it's really all comes into play when you're doing something like cannabis care, because this is a plant that can be a catalyst. It's something that can expand perspective. It's something that can induce self-change if you have some of the structures and guidance that allow you to do that.
It's very interesting the way you present it like that. I guess what I'm interested is, as a result of being quite active on social media and then also quite active, on the coalface of dealing with patients, what are the types of things you're seeing day to day? Like, what are you seeing as questions from patients? What are you concerned about that is being done, say, the right way or potentially not the right way in the current state of medicinal cannabis in Australia?
I think that we're really lucky because with this new emerging space, we have an opportunity to really engage in personally tailored care. It should be a really holistic view of this person. And of course, that's, it's very difficult to do if you're on 10-minute or even 15-minute consult cycles, to get an accurate idea of what, this person is presenting with, where they've come from, what they've tried, the trials and errors and pitfalls of that process, and, where they want to go from here. It really takes that in-depth care. And this is, I think, where nurses really come in, because nurses are taught to care. That is that bedside manner. It is that, that point of reference and communication that people can utilize in an accessible way as well. And the things that are done well, I believe, are when an individual comes in, and it's not just what strain can we provide this person with, what oil can we give them with. We'll start them off with the lowest dose and titrate up mindfully to find that therapeutic window. But coming into it with, all right, what are your goals? What do you want to see done? And it's usually things like get a good night's sleep, have a day free from pain. But what happens once you've had a day free from pain? What happens when you can move more fluidly? What happens when you've had a good night's sleep and you can function the next day? How can we incorporate these benefits into your life? And with something like cannabis, where you have, maybe a pretty defined singular goal in the essence of somebody presents with their primary concern, we have these side benefits that kind of shoot out the sides and help to recorrect other imbalances, other aches and pains, other anxieties. And so if we can use that personalized response to really tailor it to the individual and help them get the most out of it, then we have an opportunity to get some pretty amazing outcomes.
Yeah. And what I was just going to say, what does constitute personalized care in cannabis? Like, how do you personally tailor cannabis to a patient? Because I dare say there would be some people that have experienced care in cannabis that might be akin to your description earlier of the hospital kind of, you need this for everything kind of. It's just CBD, it's just THC, it's just this one product and that's it. See you later. I'm not saying across the board, but I'm sure that there would be people that would attest to that experience. So what does personalized care really mean for you in the context of cannabis?
I think that it's all going to come from the patient outwards. It starts off with, their history, their presentation, what their actual needs are, and then what their goals are. So if you have an individual, it's just such a nuanced medicine because we're dealing with a very nuanced system. We have hundreds of potentially bioactive compounds within cannabis, and we are also piloting a vastly complex physiological system that is comprised of far more than our components in isolation. And depression is far more than serotonin. ADHD is more than dopamine. And so we have this heterogeneity to our systems, and we have this wonderful plant that happens to kind of prop up those systems as well. Within cannabis, obviously we have those big guns, CBD and THC, and through their primary actions at the CB1 and CB2 receptor. But we also have homeostatic actions across the TRPV1 receptors, the GPR receptors, the neurotransmitter and neuromodulator receptors that we have as well. So within cannabis, you might have those heavy hitters coming in, and that's really what we look at, but it's simplified too much. If somebody is experiencing ongoing anxiety, ongoing sleeplessness, then it's likely they're going to have a deficit in GABA, which is that inhibitory neuromodulator, our own natural anti-anxiety compound. GABA is tied to cortisol and glutamate and adrenaline. So when GABA is really low, there's no GABA to balance out the cortisol. And so you have these extended cortisol hikes, and that puts somebody in a state of physiological, psychological distress. And so when somebody comes in, I'm going to be looking at the foundational needs of their physiology. Can this person benefit from some GABA, an endogenous compound? Can they benefit from some PEA, palmitoyl-ethanolamide, that endogenous cannabinoid? Can they benefit from some magnesium glycinate to help with their sleep? A lot of what we have here is people coming in expecting miracles and sometimes getting it, for sure. And a lot of people, there's a lot of tweaking that needs to be done to find that sweet spot, especially when people get excited. And we have this, the wonderful effects of the placebo coming in. I've heard incredible outcomes off of a couple of drops of CBD, and a lot of what that tells me is that person's mind is strong enough to induce that positive effect. But if we're not looking at the whole person, then we could be masking things that could be dealt with potentially quite simply.
Yeah. And it's I'm just interested in that thing about how some patients come in expecting miracles. I suppose there's probably a tendency among those who work in the industry that, we've heard all the feel good stories and that sort of thing. But in my experience, having, met a few people in my time who suffer from chronic illness, I don't know if they are expecting miracles. I guess this is a general just query about the state of mind and the disposition of people when they arrive at Heyday for the first time. But, when I've met people who are chronically ill, they're like, I guess, because humans are so adaptive. They've just adapted to whatever condition they're living with. They're kind of, this is, begrudgingly, okay, I'll try something new again, but I've tried like 10 things before. I'm already just feeling defeated. I'm not expecting anything from this. Is that something you come across a lot, or are most of the time people coming in and they're kind of like, oh, medical cannabis, this is exciting, I want to give it a crack?
That's a fantastic point. We definitely get those people in. It's a Hail Mary, it's a last resort, and a journey like that often layers in its own cynicism, and almost a healthy cynicism, because pinning your hopes of happiness on this next thing is a recipe for disappointment. And a lot of these people have experienced that disappointment so consistently that they definitely bring that into these sessions with them. A lot of these people have not had advocacy. A lot of these people have been pushed to the sides by medicine because they were too difficult to treat, or because their copy-paste treatments weren't working. And there is an element of hopelessness that comes in with these people that you need to address in a realistic way, but in a hopeful way as well, because we want to encourage that person. And everything is a combined effect of what you do and what you think about what you're doing. And so if you can help to give people those structures, and we have the information to back up what we're saying as well, so it adds that level of credibility to it. It is definitely, it's a split. It's some people get in there because they've seen a Daily Mail headline about CBD curing something.
Yeah.
And Daily Mail has done a lot of that.
People read Daily Mail? I didn't know this.
On Facebook, they do.
Okay.
And that's and we get that cohort.
Yeah. And we're happy to have that cohort. You know what? Daily Mail readers, go on down to Heyday. But
Come into our
okay.
audience.
Well, let's dive in with some I guess, anonymized anecdotes. I want to hear from the coalface. Can you give me maybe just some examples so our listeners get a feel of kind of what it's like to be a nurse in a clinic, and the good, the bad, the ugly, wherever you want to take this, Cam, the floor is yours.
All right. Well, the good is that it really is a transformative medicine, and I'm talking about when the element of THC is added in. Particularly, not that you can't get great outcomes with CBD only, and there are a lot of people that are prohibited from using THC because of driving regulations, but particularly when THC is added into the mix, there are a few things that happen here that really no other medicine can do. THC can modulate the emotional response to pain, the emotional response to trauma, which means that when that pain inevitably arises, because we're not curing anything, but we can alter the perspective so that when that pain does come up, there's some distance between the awareness and the pain itself. Instead of feeling everything and being it and identifying with it, if we can take a step back and be able to move through it. So it helps give people the capacity to engage in the things that really make a lasting difference. And that's what we need to be focusing on, is not, what products are we going to put this person on for life, but what products are going to get the greatest outcomes, because when that person feels good enough to engage, they might just engage. And it's a numbers game. Sometimes it takes, weeks or many sessions to, get that person to finally make that decision, because it's a difficult decision to make. Sometimes the change is difficult, especially when you've been in a rut for a long time. My personal favorites, I love conditions like ASD. I love conditions like ASD, because a lot of the time you're not just dealing with that individual patient, you're dealing with their family and their friends and their network and the other people in their care team. And conditions like ASD, they can usually have profound shifts and very quick shifts, and the person caring for that individual, a lot of times they get their life back as well, because they're not spending all day trying to care for somebody that can be very challenging to care for in terms of behavioral disturbances and mood dysregulation and an inability to deal with sensory overload. Introducing a medicine like this that can kind of pump the brakes on all of that and make existing a more tolerable experience, that has profound benefits on not just the individual, but everybody involved. Conditions like fibromyalgia. So these conditions, we see that there's a theme where all of them at some point have been correlated with an endocannabinoid deficiency. And when we introduce these external phytocannabinoids, we almost help to prop up those missing pieces. Fibromyalgia, endometriosis, PTSD, especially PTSD, just responds so well to cannabis. And part of that, again, is that the modulation of the emotional response to that. If we can take away a little bit of the direct identification and intertwining of that self with that condition, then we grant greater space for perspective, and that perspective can help to lead to new decisions, mindsets.
And I'm just interested. So like when you're talking about that in the context of this personal care, it sounds kind of like, matching, let's say, almost like matching strains to people, like finding that kind of profile personalization, let's say. I'd love to hear your thoughts on that. And also, basically how a strain is different in how a different strain, so the same strain, let me get this straight. The same strain can affect different people differently, and different strains can affect different people differently. So I'm very curious to get your perspective on that.
So it's something that starts off as an abstract science that becomes more refined as that patient gains further experience, and they can try new medicines in a safe and mindful manner.
Mm-hmm.
It's those first few products, we try to make it as informed as possible. And something that I'll do sometimes as well is I'll ask somebody about their favorite scents, their favorite natural scents. Is it people tell me about a pine forest that they lived near growing up as a kid. They tell me about their mom's perfume that they wore. They tell me about they love the smell of lavender. And so I'll kind of take those factors and bring them into the practice by associating the terpenes of those natural aromas, because your nose knows, and we're not at a stage yet in Australia where we can allow people access to these products with their nose. You can tell pretty immediately whether something is going to be a good fit for you by smelling it. The nose can distinguish over 1 trillion smells. And when this information comes in through our olfactory center, it bypasses the prefrontal cortex and goes straight to this amygdala and hippocampus, where we store these emotional memories. And so smell can be a really strong trigger for something. Everybody's had a moment where they walk past the scent and it triggers this nostalgia.
Yeah.
I'm not really sure where it's coming from. It kind of just presents itself in colors instead of any distinct imagery. You're not sure, but it's making you feel something. And that's the same with this plant. There are elements of the constituents in these plants that they can trigger that response. So the goal, because we don't have the ability to use our nose, we try and tailor it to the individual in that regard. So we might consider starting somebody off with an approachable profile with linalool and limonene, something that is going to potentially have some action at the GABA receptors, inducing a little bit more of that anxiolytic effect, and then some serotonergic affinity, and give them a little bit more peaceful happiness. And so if we can use that to make the THC more tolerable, round off the edges a little bit. Generally, if we're looking at somebody who's THC naive and they've never really had this before, or maybe they had a joint in the 90s and they had an awful time, and so there's that fear response that's been consolidated. They're scared of THC. Very
weed
hesitant.
to be fair, weed was so much worse in the 90s. Let's just about that.
Depends where you were.
It's pretty bad in Geelong.
It would have been pretty bad because you're in primary school then. But I'm interested to know how that went, because I'm not sure what. Actually, curiously, that's a good question. Like, what is we hear? I'm going to take it on a quick tangent based off that. Funnily enough, as a nurse or somebody, let's say a healthcare professional in the space, we often hear can't give it to somebody under 18. But at the same time, the reason it was basically granted access in Australia is for, pediatric patients with epilepsy, sure, more on the CBD side. What is the safety profile for that cohort under 18s? Like there's a lot of, obviously the advice is if you're breastfeeding or pregnant, do not take it. If you're, a child, you should not have access to it. But
cognitive development, all that sort of stuff.
And I'm just curious to get your take on really, not without incriminating yourself, just do you know what I mean? That safety profile in a day-to-day terms, what light you can shed.
So the endocannabinoid system is one of the first things that develops in the human, in everything. It's this ancient primordial system that it eclipses many of other systems in terms of age, and it's also highly influenceable. A surge of THC binding to CB1 receptors and potentially disrupting the natural production of anandamide at an early age could certainly have some effects in terms of that person's ability to produce anandamide on their own. And then that's a tricky situation, because if they're not producing that, then they're just going to be so much more likely to utilize THC. And there are concerns about cannabis and the growing adolescent brain. The studies are conflicting. Some say that you drop IQ points, and some say that you drop IQ points and that's a temporary effect, and when the cannabis use ceases, those IQ points come back. And some of them show cohorts of young students that not only do they regain those IQ points, but they actually go higher than average, which comes into the multitude of factors that go into why a young person might use cannabis. And I think that we need to seriously consider whether the use of cannabis in a strategic and monitored and observable way is more harmful than what that person might engage in or do without that cannabis. And we do look at the number to treat versus the number to harm. The number to treat for cannabis is pretty low, and the number to harm is very, very low. With these other drugs, we have such a narrow therapeutic index that the number to treat and the number to harm are close to each other. And we don't really ask about the side effects of SSRIs and these other, heavy duty, benzodiazepines, mood stabilizers, amphetamine-based medications. We're not really looking at whether those side effect profiles are comparative to cannabis, which is silly. We should be asking questions about absolutely everything.
Yeah,
I think that we don't know for certain in relation to any of this stuff, and it really has to be personally tailored, patient by patient. We're not here to perpetuate any addictions, and these kids will, at the age of 18, be able to go and buy alcohol, which is absolutely guaranteed brain death of cells. So which one is are we talking about lesser evils? Or are we just trying to find a suitable arrangement for these people? And then the individuality of the endocannabinoid system. You do have some people that come across THC and they feel like it fits a gaping hole in who they are and how they feel. They feel normal for the first time. And we absolutely have differences in our endocannabinoid tone, the expression of how many CB1 receptors somebody has in their brain, what their baseline serum level of anandamide is, what their capacity is to release these components. And the system can be upregulated through exercise and positive social connections and healthy diets. But some people find cannabis is the thing that works for them. So
just playing devil's advocate a little bit here, but arguably isn't part of that, when you're talking about, let's say, traditional first line therapies, SSRIs, these types of things, arguably, is their usage not more predictable in terms of the outcome on a across the board? Maybe there are a few people it's different for, but you can almost be guaranteed that if a patient takes X, they're going to have Y response. Is that, or is not the case in your view? I'm just curious. I'm not suggesting it is either way, but
they're generally really consistent. A lot of those medicines are really consistent. They've been perfected over years of these studies. The outcomes are quite often predictable. The side effect profiles vary from person to person. And if you're a 17-year-old kid and you're taking an antidepressant that completely kills your sex drive and libido, that's not a very good place to be. But we don't really talk about that because it's just a side effect, as long as you're not depressed. But the apathy and the anhedonia and the lack of motivation that can come with these things, especially SSRIs, serotonin is the keep me here chemical. When serotonin's released, it's a beautiful sunset. It's walking along the beach with your friend. It's a beautiful moment that you want to extend. And that can be difficult when you layer in an SSRI, increasing that serum concentration of serotonin, which wants to keep that person there. We want to get people moving. We want to get people feeling good enough to where they can engage in the things that will make the difference. And I don't think there's enough aftercare in that regards. I don't think there's enough aftercare on how you can recorrect somebody's potential serotonin deficiency and also get them engaged in dopaminergic activities that will get them off the couch and get them to go and pursue.
Okay, I got to ask just a really generic question, because somebody asked me this the other day and I honestly couldn't tell them. At kind of what dose because you hear about people, recreationally using cannabis and having the munchies and that sort of thing, but I've kind of rarely heard patients report that they've, gone down and ordered 15 strawberry sundaes from McDonald's, usually 14, but like they kind of, it's just not something that's widely reported. So I guess my question is it the fact that, say, if somebody is suffering acute pain, the most important thing by having THC is just overcoming that episode of pain and they're not really thinking about anything else? Or do you actually have some patients that they're getting a lot of therapeutic value out of what they're taking, but do have this other thing where they get very hungry, sleepy? What's your kind of experience as, THC as a medicine?
Cooked, we refer it to, Andrew.
It absolutely happens. That's that list of side effect profiles. And what we want to do with every person that comes in, you are trying to establish their individual therapeutic dose. And that dose is the dose at which they experience the benefits that they're seeking without experiencing any side effects that they personally deem as intolerable. For some people, the munchies are intolerable. They become something that they don't recognize, and is scary. And no one wants to feel like they're out of control. There are differences to the way that people administer these things as well. If you're using it for sleep and you dose it late enough at night to where by the time those effects really kick in, you're not going to get up and go eat something. But the other aspects of daytime administration, certainly the munchies can come into play. But we want to keep these doses as low as possible, because generally the more THC there is, the hungrier people get. And we can balance this out by looking at different strain profiles. Something that is high in humulene is generally not really going to induce that much munchies. But I've found that strains that are really high in limonene and pinene can induce munchies as well. So if that's something that individual wants to negate or find the way around, then it comes down to that individual tailoring.
I've always been looking for a scientific explanation as to why I go more for the pinene and limonene strains, but yeah, you just answered it.
Which strain makes you want Tim Tams? I actually need to know for Andrew's sake, because
Anything Australia grown.
yes, very good.
Lathered
Very
in
good.
Yeah.
Mine makes me want Lamingtons apparently, but anyway. No, that's very interesting. I mean, look, we talk about it. I think that there's a good segue, because there was something I wanted to ask you in terms of, we talk about cannabis as almost this miracle drug. Sometimes it helps this, it helps that, it helps pain, anxiety, sleep, neurological disorders, sexual health, all sorts of stuff. Curious to know what doesn't it do? Like, in terms of who comes to the clinic potentially and says, hey, I'd like to try it, and you're like, it's not for you. Is there a profile of a patient, or are there specific indications where you're just like, people think it helps this, but it's not actually, there's actually better stuff. You know what I mean?
Yeah.
Very curious about that side of things, because we give it a lot of, positive air on here, but I think it's important to balance that out.
I think that osteoarthritis is not very responsive.
Yeah,
especially
I
the
agree.
CBD. Like CBD
You
doesn't
need
really touch
something
the edges.
like heavy duty anti-inflammatory. Yeah.
Yeah, we find endocannabinoids are a good option there, trying to modulate that inflammatory cascade at the very start, which is part of what endocannabinoids do. But osteoarthritis, it's a different type of pain, and cannabis.
Yeah.
It's like THC can do it, but is that THC actually alleviating pain, or is it again
Masking.
modulating that emotional response so that you're just not as aware of it anymore? Which that's a way of alleviating pain. I think there are lots of different pathways that we can take to achieve these outcomes. And meditation, absolutely. I mean, getting people involved in meditation, especially people with anxiety, depression. THC's ability to help you kind of neutralize intrusive thoughts during meditation allows for that greater control, that response over how you feel instead of just reacting to everything. Anxiety is a tricky one, because we can definitely have an inverse response with THC. A little bit of THC for anxiety might help increase sociability, receptiveness, general mood, but a little bit more THC can induce significant anxiety.
Yeah, no, it's interesting. I know, for example, rheumatoid arthritis is a prime candidate, but I agree. The osteo I've seen firsthand with people I know, it's having a different. Which also brings me another. I'm loving the segues at the moment, but it brings me to the next thing I really wanted to find out from you is. Would love to hear any standout stories that you've come across where you're just like, wow, that is just a great story within the sphere. Like you must see all sorts of situations, people, types, obviously anonymized, but would love to get that.
I had one of my favorite patients this week. Can I say that? Favorite patients? Don't take offense, any of my other patients. You're all anonymous anyway. I'll name her patient Annie. Annie's son, nonverbal autism, just a horrendous lifetime of treatments that were largely ineffective and pretty just incompassionate, at kind of a wit's end, wanting to provide her son something of a quality of life, and started him on CBD, a full spectrum CBD, and started to see a good outcome, and then introduced a balanced oil, a balanced blend. And he went from he would be constipated for 6, 7, 8 days in a row. He would never sleep. He couldn't really eat anything. Much of his day was just dominated by this persistent emotional extremism. And it was night and day, like literally a different human being, a different person. He can communicate his needs to her. He smiles, he laughs. He's started going sailing. He swims every Tuesday. He goes to social clubs and meetings. He's in a community now. He has friends. And then the patient's mom herself, she had fibromyalgia, long-time fibromyalgia, and thought, well, I might as well try this out too. And went on the same blend and experienced a profound shift in her pain as well. So it's like they both at the same time, not even reclaimed, because that life wasn't really there. They stepped into a new life for both of these people, which is a beautiful thing, because every time we catch up, it's glowing, heartfelt praise, and it's so authentic and it's so genuine. She books consults just to say hello and say thank you again. I was like, you said thank you. I appreciate you.
Oh, that's
Love
amazing.
that gratitude.
Yeah.
Well, no, Cam, thank you so much for joining us. I know you've got a hustle. I don't know if it's whitewater rafting. I know you're going to America very soon as well, but
Andrew's playing coy. He left his charger at the office and he's on 8%. And if we don't shut this down now, he's going to lose the whole recording. So that's the truth. We had so much more to talk to about.
Pressure to find my charger, but thank you, Mitch. Well, boys, all right. Thank you so much for the chat. We'll do it again soon, and have fun in America, Cam.
Absolutely. Thank you, boys.
Most abrupt ending.
Right.
Anyway,
Cutting you off,
thanks for that heartfelt story. We'll catch you later, mate. Like, don't worry about it. Yeah.
all right, yes, you're done, Mitch. You're out.